today we will see about tissue. So what is tissue? It is aggregation of cells to perform single function is called as tissue. So there are total four types. So one is epithelial tissue. So it is of two types, simple and stratified. And simple is squamous, cuboidal and columnar. So function of epithelial tissue is mainly covering of the body. Example by skin. So protection. Then covering of organs like liver, kidney. Protection of body and organs. It is main function of the epithelial tissue. Second is connective tissue. So mainly it is blood, that is liquid connective tissue. Then fibrous tissue, elastic tissue, adipose, reticular tissue, and cartilage. So cartilage is of three types: hyaline, fibrous, and elastic cartilage. So function of connective tissue and cartilage is connect systems, covering, protection, and shock absorption by adipose tissue. Third is
Cartilage, it is much firmer tissue than connective tissue. The matrix is quite solid structure. The cartilage is second component of the skeletal system. Cartilage and bone form supportive connective tissue. In cartilage, the matrix consists of elastic substance called chondrine. It is hard and elastic and gives cartilage its elasticity. The matrix is secreted by small groups of cartilage cells and chondrocytes. It is covered by a fibrous membrane called perichondrium. Cartilage provides flexible support for certain structures in adult human, including nose, trachea, ear. Cartilage has a slightly pliable matrix due to chondroitin salts. Cartilage consists of two types of fibers, collagen and elastin fibers. The cells that form cartilage are called as chondroblasts, and mature cells of the cartilage are called as chondrocytes. The chondrocytes lie in lacunae in the matrix. The outer layer of cartilage is known as perichondrium. Unlike bone, the cartilage is avascular, which means it contains no blood supply. However, perichondrium contains blood supply. There are three types of cartilages: hyaline cartilage, fibrocartilage, and elastic cartilage. Hyaline cartilage, the most abundant of three cartilages, and functions to help surface slide over one another. Example, it is found in respiratory system. Fibrocartilage, this cartilage is tough and its main function is to provide support and strength to structures. Example, found in healing tissue during wound repair. Callus. Elastic cartilage. This cartilage is abundant in elastic fibers and contain to maintain the shape of area it is present. Example found in middle ear.
tissue. So it is mainly bone, and bone is of two types, spongy and compact. So when the Haversian system is complete in that bone, it is called as compact bone, and when it is not complete, it is called as spongy bone. Or other types of bones is long bone like femur, humerus, short bone like carpals, metacarpals, irregular bone like vertebra, sesamoid bone like patella. So sesamoid bone means from the tendon the bone is developed. It is called as sesamoid bone. So function of bone is protection of body organs, site for hemopoiesis that is present in bone marrow, then calcium and phosphorus storage, and two or more bones form joints, and joints are required for the locomotion or movements. Fourth is muscular tissue. So it is of three types: skeletal muscles, so the which connects to the bones, so it's called skeletal muscles. The function is movement of the body. Then smooth muscles which are present inside the organs, so movement of the organs, and cardiac muscles which are present in heart, so movement of the heart like systole and diastole. So systole is contraction of the heart and diastole is relaxation of the heart. Fifth tissue.
Each organized skeletal muscle in our body is made up of number of muscle bundles called fascicles held together by common fibrous covering called fascia. Each fascicle consists of number of muscle fibers, cells covered by a common fibrous perimysium. Each muscle fiber is lined by a plasma membrane called sarcomere, enclosing cytoplasm called sarcoplasm. The sarcoplasm contains endoplasmic reticulum called sarcoplasmic reticulum, which is the storehouse of calcium ions. Muscle fiber is a syncytium as the sarcoplasm contains many nuclei. Muscle fibers contain large number of parallelly arranged filaments in the sarcoplasm called myofilaments or myofibrils. There are two types of myofibrils are present in the sarcoplasm. Thin filament is called actin and thick filament is myosin. The arrangement of thick and thin filament gives the characteristic striated appearance. The light bands contain only actin filaments and are called I band and isotropic band. The dark band called A or anisotropic band contain both actin and myosin. In the center of I band is the elastic fiber called Z line, which bisects it. The thin filament or actin are found attached with the Z line. The thick filaments of myosin in the A band are linked together in the middle by a thin fibrous membrane called M line. The portion between two successive Z lines is considered as the functional unit of the muscle called sarcomere. Each A band contains two overlap zones of thick and thin filament called O band. The central part of thick filament not overlapped by thin filament is called H band. A band is equal to 2O plus H. The function of skeletal muscle is to contract to move parts of the body closer to the bone that the muscle is attached to. Disorders of the muscular system. So first is myasthenia gravis. This is autoimmune disease where the antibodies affect the nerves and they lose their ability to generate muscular contraction. Muscles of the face and neck are most affected. This leads to fatigue, drooping eyelids, difficulty in some cases, inability to swallow, weakening and paralysis of skeletal muscles are some of the examples. Muscular dystrophy. In this, there is progressive degradation of skeletal muscles of the body due to their genetic disorder. These continue to lose their ability to walk, make movements with their hands, etc. as they do. Tetany, uncontrolled twitching of muscles is called tetany. It is condition where there are rapid spasm in muscles due to low calcium in the body. There can be many causes such as nutritional deficiency, infection, or other nervous system disorder that can cause tetany in muscles. Sprain and strain, the common muscular disorder. There are two different disorders. A sprain occurs due to injury to the ligament and the joint is twisted that there is no dislocation of the bones. They can be mild to severe and can be accompanied by inflammation and pain. Severe cases also cause immobility of the body. Strain is less severe than sprain. It is injury to muscle or tear in the tendon due to overstretching. The strain is caused by twisting or pulling of muscle or tendon. Strains can be acute or chronic. Acute pain strain is caused by trauma or injury such as the blow to the body. It can also be caused by improperly lifting heavy objects or overstressing the muscles. The nervous system is made up of millions of nerve cells called neurons. Each nerve cell neuron consists of cell bodies called cytoplasm. The cytoplasm contains granular cytoplasm called neuroplasm surrounding the large nucleus. The scattered in cytoplasm are found in long related fibers called neurofibrils. The neurofibril conducts the nerve impulse. The cytoplasm arises two types of processes, axon and dendron. The axon is single long process ending into many branches. The dendron and dendrites are small processes. There are many in number and short or long in length. Each dendron is profusely branched at its tip. The dendrons conduct impulses towards the cytoplasm, while axons conduct impulses away from cytoplasm. According to structure of the axon, two types of nerve fibers. These are medullary and non-medullary. The medullary nerve fibers are myelinated nerve fibers are covered by fatty sheath called medullary and myelin sheath. The non-medullary are not covered by myelin sheath. The myelin sheath of the nerve fiber is non-continuous. It is continuity is broken at regular interval, forming the constriction called nodes of Ranvier. The nerves of Ranvier are the points at which the Schwann cells begin and the other Schwann cells begin.
Nervous tissue. So it is mainly unit of nervous tissue is neuron, and neuron is made up of cyton, that is cell, and the fibers which are present to the cyton is called dendron, and single fiber present is called as axon. And then there are of various types like motor neurons, sensory neurons, or mux neurons. So the function of this nervous tissue is transmission of nerve impulse. An example of nervous tissue is brain and spinal cord. Thank you.
Neuroglial cells. So first is microglial cell. Microglia are macrophage cells that make up the primary immune system of the CNS and they are the smallest. Astrocytes, star-shaped microrhizates with many processes found in the CNS. They are most abundant cell type and intrinsically healthy CNS. Oligodendrocytes, CNSs with very few processes. They form myelin sheath on the axon, which are lipid-based punctuation that increases the speed at which the action potential can travel along the axon. In due to blind, the CNSs that are distinct from astrocytes. Oligodendrocytes are microglia. They serve as the developmental precursor of oligodendrocytes. Schwann says the PNS equivalent to oligodendrocytes. They maintain axon and form myelin sheaths in the PNS. Satellite glial cells lie on the surface of neuron cell bodies and the ganglion groups of normal cells bundled or connected together in the PNS. Intricula found in intricate nervous system which within the gastrointestinal tract.
Hope you find this session useful for your understanding and for your exams. Thank you.